welcome to our podcast. I'm Dr. Pramod. I'm sure you know. You can introduce your Arun Mohan and your Danya Arun. So a music family, I would say. Kind of, no? And also an engineering family.
Yes, technically.
Yeah. So if you can introduce yourself. What you do?
I have completed engineering in electronics, Triple E only I completed, but I am working in automobile field, designing and...
Oh, nice. One of my favorites. Danya, you?
I've completed MSc Maths, sir. I worked in Axis Bank for 3 years, and after marriage I resigned.
But you're also into music because of him now.
I actually learned violin when I was in childhood. I'm interested in music, so I'm helping him to do.
Nice. I've seen your YouTube video. In fact, I told you in the first time when we were doing your first surgery, we saw your YouTube video. That really made us inspired. So, let's tell us about your journey about this problem. Of course, I would always say it's a problem rather than giving it some nice fancy diagnosis. So, this problem, everybody gets a problem. You also had the problem. Tell us how it was initially. How old were you and how did it start?
Age-wise means...
How young were you?
In age, 34 and 39.
Now you're 38. So it started...
This one 39.
Oh, is it? Oh.
Check on my normal whole body checker. There we diagnosed something is there inside.
Inside the stomach?
Inside the stomach. Then we went to another hospital and... we found
When the scanning was done, his right kidney was not visible, sir. When the ultrasound was done, the right kidney was not visible. They found a huge mass inside. So when CT was done, they said it's a mass is there. You have to go for a surgery.
Major surgery.
Since our physician told it might be cancerous or non-cancerous, you be ready, mentally you be ready.
Oh.
Like that.
So this is, I'm talking, that means it's about 2021.
22 February only we got
Yeah, so you had an abdominal mass, then they got a biopsy, worked up everything, they did the workup. Where was this? Which place was this?
It's in Palakkad only we first diagnosed it, then we went to Amrita Hospital.
Amrita Hospital, Kochi, yeah, correct.
But the surgery and the biopsy, everything was done
in
Vellore CMC only. Since that was a very big surgery, so my family suggested to
go to Vellore.
Go to...
Not Amrita, we'll go to Vellore, they told you, first surgery.
First surgery.
They have not done biopsy even in...
biopsy, taken the sample and...
PET CT was done in Amrita Hospital as well as in CMC Vellore also.
So when PET CT was done in the beginning, so their disease was only there?
Yes, they found only that.
Only there. So and the
biopsy
biopsy
like growing very fastly.
Okay.
kg mass.
10 kg mass.
No, finally, one taken, 10 kg mass. Around, while the diagnosis, it should be around 6 kg like that.
Or when it was diagnosed, it was...
After 3-4 months, we took it out. 4 months we took it out. At that time, it is like 10 kg.
So when it was not there anywhere else, the biopsy also proved there only it was liposarcoma, Myxoid Liposarcoma. Then they suggested to go. I mean, your family suggested.
So like the biopsy report, they took almost 21 days, sir. 21, almost a month. After that only the surgery was done. Actually, the statement was it's a differentiated type of
Dedifferentiated.
Yes, liposarcoma. That was the statement written in the...
Then in the Vellore you went, they did a scanning again, then they did a surgery of that area. Right. So you were doing music till then?
Was doing music or business?
Business and music. I mean, yeah.
Daytime business, nighttime music. Like that, this is good.
So
Your life.
you had children by the time?
No.
Oh.
No, after when diagnosed, it was, we have children.
Both?
Yeah.
How many kids do you have? Twins. Oh, nice.
Actually, like 2021 April, we had our children. Like September, October, he had his corona. Then the next year, for the first birthday, we are celebrating the birthday of our kids, and next day we are going for the surgery.
Oh, I know it must be super difficult. Like recently I had a similar thought someone had and how difficult when in the hospital to celebrate a birthday of their children. So then you underwent a surgery, they removed the tumor. So then you went home. So then what happened?
That chemo was chemo. Actually, they didn't suggested the chemo. They firstly they told there is no medicine for this thing. Chemo will never work. But my surgeon personally suggested to the oncologist, give him chemo. Like that, I came to know with
Okay.
co-doctors while talking. So that's why they recommended chemo. Medicine, no?
Epirubicin.
Epirubicin.
Sarcoma and
Yeah.
I first.
But for 4 cycles only. Since the corona, history of corona considering.
Oh, so they told only 4 cycles.
Yeah, to only one agent, sir. Epirubicin only.
Only one drug.
Only one medicine. They didn't mix 2 medicines. But when we went to the oncologist in Coimbatore, we did it in KMCH, Kobe Medicals. There are doctors, he suggested to take 2 medicines.
2 medicines, each cycle must be taken, he suggested only. But since we are facing for the first time for the cancer, we are totally confused what we need to finalize. So
Actually, his right kidney also is removed. So we were scared to take, and then next summary also they have written since he is underwent chemo, it's safe to take one agent for chemo. Like that they were written in.
Oh, maybe corona, single kidney is gone, so that's why single agent drug was.
Yes, so we were also like a little scared to take 2 agents.
2 agents, yeah. Anyway, we took one.
But we completed 4 cycles.
So then from Vellore, how did you land up in Coimbatore?
And that was near for us, sir. From Palakkad, only 1 hour.
So you took chemo, and after that you were on the follow-up there regularly?
But follow-up we were doing it in Vellore only, sir.
Then how did you land up in the after that you had a thigh mass?
Yes.
That is after how many months?
November.
18 months.
For 18 months you got a thigh mass. So that was also seen and removed where?
In Amrita Hospital, Kochi.
No, the Amrita Hospital, Kochi. Everything was clean and removed. So after that, when you scanned, nothing was there.
Nothing was there, no recurrence. Also, I didn't undergo any radiation and all.
No, never had any.
Never radiation. But after the thigh, 1.5 month, I got a pain over my stomach area.
Okay.
Little apart stomach area. Then maybe within 2 weeks, I was unable to walk. Then we went to scan again. The surprising thing is, after the scan, I am able to walk. So the pain is there for.
But there was a mass there again?
Yes, sir.
Mass there.
Around that kidney where it was removed. Same side.
Same side, but on the walls.
On the walls. So it was removed again.
Simultaneously, sir, on the abdomen and in the left.
Together it came. I noticed that I was unable to
Move the elbow.
move completely.
When was this? Which year?
In 2024.
2024.
In 2024 May, the thigh was removed. Thigh tumors were removed, and only after 3 months we diagnosed both in abdomen and left elbow together.
So it's been coming. And the both abdomen was removed. Where was it?
At that time.
Amrita Hospital, Kochi. This year.
Thigh and abdomen both was removed this year.
Thigh was removed in 24 and abdomen was removed in 25 January.
So then this one started growing. The elbow one. So in the elbow one, when you met Amrita, they said we cannot.
After the surgery, he is in the healing procedure. Actually, he didn't have only 2 months after the surgery. So we were planning for the elbow treatment actually. That time he got a pathological fracture.
We didn't came to know it's a skeletal skeletal lesion area. Actually, it was written on the scan, but that time we didn't read that scan report. That was our mistake. So even though we didn't know this will happen, it will
Break the bone or something.
no break the bone or something. We didn't know. It's
So if
after
you broke, that got pathological fracture, it's a small movement, it just broke. It's an impending fracture, just broke. So after that, so you went, I said they can't fix it, is it?
After that, after that means once the fracture has happened, the tumor characteristic of the tumor changed. If it got disturbed with something, I have done fasting. So 11 days on the thigh.
You are so many
resources of my own. Naturopath, 11 days fasting. After came back, normal life.
Integrated care.
It's in 1.5 week. It got huge pain here and ran for the surgery.
Which on this one?
this thigh. That was the experience. And the second experience, when the bone were broken, no, always it will injured.
The tumor.
The tumor starts growing immediately to a certain amount of size. Maybe 1 week they took another biopsy. That injury again made it trigger to
More faster.
more faster.
Oh yeah, no. It's very important to observe because see what we have studied, what is science is up to one level of observation, but every individual experience is very important for us to learn. No? So that is how we have come all the way like this.
So at that time the hand goes like straight. I am unable to move like anything.
And what happened is after that biopsy, no sir, actually the bone was like this. After the biopsy, the bone went
Separated.
upper part went in.
The middle,
The gap was
middle, it
So then you went to Amrita. Amrita said you had to amputate.
yes. Amrita people finally.
used that word, but literally it was the meaning. But nothing can be done.
We will see you keep it like this. We will see. Keep it like this. We will see. Next month we will see like that. There.
It's like we'll do the plaster of Paris and let us see whether the bone gets attached by its own.
The pathological fractures never unite unless there is a strong.
In the meanwhile, we went to many hospitals, including.
Not ready to ampute also, sir.
Yeah.
Or you are not since.
That way we got distanced from there and we came back home. We thought after coming home we'll decide what.
Actually, with this my history of all this experience, I was very much ready to face all these things, but only the condition comes now, the hand will get amputated. That got me scared and maybe disturbed.
I've seen you. You're a very strong man for sure. I mean, whatever I've gone through with all these things, you're pretty sport. So I'm sure amputation definitely is. It'll kill anybody. That too. You're a musician. I don't forget musician. Otherwise, also it's quite a. So then you went to Coimbatore.
Coimbatore Ganga Hospital. So they also told me that no amputation. We will do our best, but no guarantee will be there. What will be, they are not sure about. Many involvements of veins and all shall be happen now. But actually at that time the tumor was something like 16 inches when measured with the tape, no? 16 inches like that. When came to you, it was like 18 to 19 inches.
Wow, it's like 1.5 feet. No, nearly like this much circumference.
Inches, 18 inches. 18.
Yeah, 1.5 feet.
Yes.
Even when we saw you, you were in a lot of kind of very discomfort, pain.
We so many hospitals we have visited, including Tata Memorial, Bombay.
For the hand, sir, the seeking medicine for the
Seeking medicine for the sarcoma. But they were always in a different type of trials and all. They were not confident.
chemo doesn't work, no sir. Same thing only we got.
So at this point, I'd like to tell sarcoma being a very rare disease. Not many people would know a vast amount of knowledge because it is every doctor, orthopedic surgeon, for example, they see 1 case a year maximum. And an oncologist may see about 2-3 cases a year. As a specialist, we see them regularly because I do only that since 16 years now. We have seen more than 7,000-8,000 of bone tumors. So that is what we have come to thought in across the world. Our specialty itself is so rare. We are about 500-600 of us in the world who do these kind of management. So that is why, in fact, we have written a policy to the government. So these are all called rare problems and good outcomes if treated correctly first time.
Yes.
If treated correctly first time after a very good workup. That means you cannot just hodgepodge. Okay, I saw a tumor, I removed. I saw a tumor here, I removed. No, now in the era of genomics, with the era of PET scan, with the era of targeted therapy, immunotherapy, it is all systemic disease rather than single area disease. So as I was thinking, because I think it's a lack of team approach with everybody talking. Like 20 people talk about one case at least 10 times before we even jump into you. Yeah. So then after Tata Memorial, you went for a drug issue. If you wanted to check whether some drugs are available, is it?
Yes, sir. They suggested a chemo, and that was when he had his tumor in the
Second tumor.
Yes.
Third time. Second tumor, second abdominal tumor.
Abdominal tumor.
Third time.
Yeah.
But it got at the time of starting, it was 6 centimeter only. 2 months.
2 cycles chemo.
2 cycles. 2 months means 2 cycles of chemo taken. It got around 13-14 centimeter like that. Rapidly it is going. I thought like when we are taking chemo now, it is getting disturbed. If it is getting disturbed, we need to kill it. Otherwise, it will show its character. If the medicine is not that much powerful to kill it, it will react. This is what
That's your observation.
that's
This time he's having his chemo, he's taking his medicine, he's getting breathlessness issues, lung issues.
and issues many and
Then he, the
pneumonia.
7th day, and the 7th day of the taking medicine, we'll take him to the hospital for giving oxygen and some antibiotics. 1 week he'll be there.
Outside, I bought oxygen in my home also. 4 days I will take oxygen. 5th day I will be admitted
Oh, yeah.
in the hospital.
I'm sure this should have impacted a lot on your emotions, right? I'm sure, for sure. But were there anybody to support from the medical background? Like we have a psycho-oncology team. Is there anybody who was supported?
Yes, sir. Medical. Actually, I have a family friend of mine who is a pediatric oncologist. He's working in RCC in Trivandrum. Actually, he only referred us to Bombay. He was a rank holder there, and so he has a good influence there. Tata Hospital.
No, not just that. Emotionally, more than that. See, I strongly feel there is a big lack. Information is there. You put every report to ChatGPT, it will give you the whole story. So now, but somebody to handhold is the discussion thing is.
Except ChatGPT, I have went through any available media.
Sources.
Such was always so many studies I have done, but nothing I gained. All same thing I am getting from maybe little more details I'm getting from each doctors. Only few minutes are sparing with doctors.
Yeah. Let's come to what once you landed at us here. I think we did a PET scan also and found that suspected lung, but plus mainly this one, right? That is only 2 things what we had. And we also took time to whether to decide about a week, I think.
And the left side of the abdomen also is heavy.
Correct. That we got it evaluated, lymphocyl and other things is the suspicion question mark. Ready for amputation here? Yeah.
I was waiting for around 4 to 5 months. Infinitely I am going since I am not ready to face that amputation. That's what my mindset was.
So we have, for us, it is most of these cases come like this only. Not only you, many of, like this week we are doing one big massive tumor in the ankle, thing turned around, then have come. So for us, the main challenge was, number one, for you understanding. As I always say, if patients or any one of them, if they don't understand the whole process or a long-term vision, means I would always tell 5 months from now, 10 months from now, 5 years from now, 20 years from now. If you do not have a thought with me, then I always tell my patients that they should not even take a tablet from me. Forget surgery. Because you should have a clearer, I'm not talking about medical knowledge. As a normal person, how you are to understand is very important. So that is, we try to make you understand. I hope you understood. With that thing, even I had a doubt that, to be honest with you, when I had a doubt that whether we can salvage it or not. But with repeated scanning, and we even give you a dose of, because it is a Myxoid Liposarcoma, trabectedin. There is a drug called trabectedin. So we even tried it out, but it did not work for sure. We tried it for 2-3 weeks when we were planning the drug.
One psycho computer.
When we were planning for the surgery. So then, of course, we had a plan A for sure to save your elbow. And more than that, when you said you were a musician, I really felt it was as I always say, there's only few opportunity God sends you to do somebody, to some help or to some service. I would not say help. When I said then, that's what I was always thinking. How can I make you play the music? So I'm sure that was a goal we thought of, no?
That was the really
Coming here, we were confident, sir, that
since we already went around South India many hospitals. So when we came here, the things are very different. The visions are very different, and what I felt is basically we were very confident. Basically your approach to the disease is very different. It seems like very different, and honestly, we came here to save my hand, but I got my life to back. Not my hand, not only my hand, I got my life to back. That thing we didn't expect it. We came here to save my hand only, but that was really surprising. Again, I am thinking, okay, I am getting the hand. What is the use? Again, I am going for maybe in 3-4 months. I am going for next surgery. That's what my mindset was. So how many surgeries I can face? That's what my mindset was. But while you are concluding with a medicine, this medicine will going to work.
That means we are taking it as a holistic. We are taking it as Arun Mohan, not Arun Mohan's elbow.
yes.
Yes, I always say we're treating Arun Mohan, not Arun Mohan's elbow. So yeah, I mean with the disease, of course, this is a big limb salvage surgery we did. For about 10 hours, 8-10 hours. I think it went on well. You're doing well, everything. But we did a genomic testing. So that genomic testing proved to be sensitive to one drug, palbociclib. Correct? CD4, right? So that's quite rare in
But I am a bit confident because I also, in the meanwhile, I also seen so many videos from your channel also. So there you clearly mentioned what is the type of tests need to be carried out when these type of cases come. So seeing that also, I am getting cleared. So many doubts I am getting cleared, clarity. And I was actually confident. Maybe I'm a bit more confident.
Yeah, I mean that's what we want. See, for me, as I say, I put a board outside. I don't know whether you read the board there outside. Only lions are allowed. Only lions are allowed. You not seen that?
Yeah.
I put a board outside. So only lions are allowed inside our office. Means you should be. Let's do it together. It's like alone I cannot do. Like I always tell, like my team, everybody should be there. So today also I was telling somebody, you please asking me to do surgery tomorrow, day after tomorrow. I said, boy, it's not like that. It needs thinking, plan, In fact, I scored in. So, confident, as you said, you felt it is totally different. Because I don't know the other aspect of what we can approach this, but if you crystallize it correctly, as a whole person, how we have to manage. With present day, I think it's because of the genomic testing, immunotherapy, and all those things. PD-L1 is negative, right? PD-L1 is negative. So immunotherapy we didn't give. So, but fortunately, this palbociclib was a drug of choice, right? And you had an implant loosening, you had to correct it, and more importantly, you could play your flute back, right?
Yeah.
Yeah, you tell your experience.
Weightless.
Huh?
Weightless. I cannot actually express my gratitude, and basically I was asking you to I need to pick my flute. That is expectation. So that thing happened yesterday. The flute, I was able to hold it in my own hand, I without any supports. That video I sent you, firstly I tried it with support, then I asked her to remove all the supports. It is there. I am able to play it.
Wow.
That thing surprised me. It is only 2 weeks after surgery.
Time itself we sent you the videos. Couldn't express our happiness with the words actually yesterday.
And I saw the message in the morning. I was also feeling, my day is done. So you tell your daughter's story. What I wanted to tell was that what you said, your children were never tell that part of it.
My daughter loves the tele-serial. She watches the Radha Krishna serial. She's very fond of Lord Krishna. She watches that serial. So she's fond of the title music also. So he first played that only, that title song. What she did is she was sitting on his lap. She came running to me and said, come, Acha is playing Radha Krishna song. Come and watch. He's able to play flute.
Able to play flute again. That is the underlying thing.
She's only 4 years old.
Yeah, just 4 years old. She's observing all this.
Meaning of after his hand is okay, he's only going to put me kajal. And he's going to take me on bike. Like that. She's also has dreams.
You should.
She and my son also both there. Sai is having in his own way. He's a boy. She's having
In a different way. Yes.
I mean, I'm sure you also told that you could never had that fun days with the children for all these.
yes. As I said, we are going for the first surgery on the next day of our children's first birthday. We did it in a small. We were planning actually. What is our home position? I'm the only daughter in my family, and in his family, actually, his sister after 8 years of marriage, she also didn't have a child. We also didn't have child after even 5 years of marriage. After IVF only we had.
Okay.
No, so both the houses, parents, they were planning very. She was so into. She bought a lot of things. She designed a dress for us. Everything she did for me, my husband, my kids. Everything she designed it. But unfortunately, we didn't able to celebrate it. We celebrate, but even though we don't want our kids to lose all that, our problem is our problem. They shouldn't be affected. So in a smaller way, in our home itself, we called our closest friends and we did the birthday celebration. Next day, we went to CMC Vellore for the surgery.
I have lost all since the children are 4 years now. These 4 years I was in like bed only.
On the bed.
Like that. Because I am sitting only. Like that. All the children saw me. Father is there. Father is an icon called a sitting person. Like that it is. It is actually registered like that.
Don't let mind, yeah.
I was unable to pick them. There was things are happening now.
For him carrying them and also.
Yeah, carrying and
So since the now phone, everything video, everything is available, I can show them. See, this is the way your father carried you when you were a child.
Yeah, 3-4 months, right? For 4 months, I was able to handle everything. After that, I got problems. So
He started getting on after the other.
So when these days, when I am doing some activities with them, they are surprised. Oh, father, you are able to do this thing. Oh, father, you.
In Malayalam you can tell.
Means you know you
Sorry.
know all these things. And like that, they ask.
Like the simple, I have replaced the batteries for the toys. They are surprised. Oh, you know all these things.
Yeah, children are amazing. This is the right time to. I'm a father of 2 boys, and I have in my family there are at least 8-10 children now, and that's the same age. This is a fun time. You should have good fun. That's what I always.
So anyway, 4 years I missed.
Yes, sir. For all the surgeries, his mind was calm. That is a great thing. I can proudly say that.
Sir, actually,
Surgery, after the discharge summary, they'll give the notes now. In that, they were mentioned the patient was very cooperative. That sentence, some incident I still remember. The patient was very cooperative and very calm. And so that even though it was like 10-hour surgery, they didn't place him in ICU and all. On that day itself, he was.
With the wall.
Yeah.
okay, seems to maybe
After surgeries, one after the other, he didn't lose his heart until the elbow.
Elbows less.
maybe I got this courage. So maybe I was since I am fatty, I was practicing martial arts. I was practicing yoga, spiritually also. So many practices was there. That thing made me. I believe that thing made me. The backup from all those things made me. But what I felt is all these backups are like battery. It will also discharge. someday I have to cry. The power will also, now I need to get charged again. That is the situation now. So,
But till the elbow surgery, he was calm only. After that elbow's first surgery, each and every word he started crying because he is unable to believe that his hands are with him. His hand is with him. He is unable to believe.
first time I
Whenever, even if his parents or my parents are in the video call,
unable to.
we have tears.
Yeah.
That is the tears of joy.
Yeah.
Actually.
No, really, that is.
Not at all.
He is bursting.
Not only for the hand. I got the hand and I got the life back. That is what my confidence is. Still, we have to see.
Yeah. It's always.
But I am very much confident what is going to happen. That confidence made me this.
Also, I have to say his father, parents, sir, without the financial support, we can't do anything.
Correct.
That is a very big strength.
Yeah. For sure. In oncology, particularly even that part also, yesterday I was talking to somebody. In fact, I wrote a newspaper article I published myself telling that these are all rare diseases. This has to be having a good support, central support system. But to have a right outcome, see, okay, let's say 50%, whatever it is, some support has to come and this has to be centralized. You cannot do this here and there, hodgepodge it, spend all the money they have saved in one angle. When they come to me, generally what happens is they would have spent in 3-4 places. And they come when I give a plan. In fact, it will be more expensive because it will be more problematic by the time they arrive here. If it is treated correctly first time, it is going to be very less expensive. So this has to be policized.
But I have a question for you, sir. What if the first diagnosis itself, what will be your, if I am coming to
Well, first time.
for the first time, what will be probably your approach?
Fantastic question. That's all. See, first I would really work you up properly. I would not even put a biopsy needle before even understanding the disease. See, gone are the days where, okay, this is an elbow tumor, this is a limb tumor, this is a kidney tumor. Now, kidney tumor and sarcoma behave similar way. So we have to understand the biology of the disease. First, number one. Probably I work you out with all the scans, MRI, PET, including genomics. If I had seen you first time, probably I would not even do the first surgery. Probably I would have tried the palbociclib, that now targeted drug, but few months. How it going to work? Is it going to melt away? Because I was telling you about 1 month back. There's a tumor here, elbow. It's just immunotherapy for 1 week. It just melted away. I was like shocked. Literally shocked. It is like, I'm talking about 2025. So that would be the approach today. And more than that, you should have a 360-degree plan. As in, probably in 2021 or 2022, when you are diagnosed, probably the trabectedins would be my drug of choice, 1 or 2 or 3 cycles. Then operated the whole thing. Probably I don't know how the kidney status was. Probably can we do the kidney sparing surgery?
Kidney was working, sir, actually.
No, it will be working, but the tumor encasement.
Biopsy, we came to know that the kidney was not at all attached with the tumor, just inside the tumor.
Exactly. So these are the planning. How I work with engineers here. We have 4 engineers. Why do you think many people have told you are crank to work with 4 engineers, But what I'm telling is that depth. I would have consulted a uro-oncologist. Can we save partial kidney resection, if at all? Or if it is a low-grade liposarcoma, probably can we save it? We did one massive tumor which is going up to the diaphragm from Oman patient. We just saved the kidney.
Even his tumor also treat the diaphragm.
I still have the gentleman's images. It needs a planning, not to rush. If somebody is in a rush, in oncology I've rarely seen any emergency, Tanya. There is hardly. So you should be calm, think, understand.
I understand, sir. I noticed that they are very good doctors only, but they have many cases are coming, be it target issues or maybe whatever it may be. They're handling so many cases that is actually it's not fits on their hand.
Exactly.
It is leaking out.
Exactly.
One of the person I have leaked out. No,
No, very, very true.
like that.
They are also human beings.
Yeah,
Make some resting time actually.
exactly. And these things need some mental thinking. See, when your volume, see, when this is my 16th year in this specialty, even now today, I don't operate more than 3 or 4 cases a week.
Yeah, that thing surprised me when came here. No, you're not taking. You're considering each case as a very big study, and you're involving in it as if somebody from your family came. No, like that we felt. That made me the confidence. Now, how you show you not only your team also show the love and care, support. Amazing. Wordless.
As I said, as we were talking about other doctors, that's why we need to have separate these specialties into separate because you cannot be handling a breast cancer, 10 breast cancer patients, 5 oral neck cancer patients, and this one. So this needs a very different methodology. So for this, that's why in India there is no dearth of cases, there is no dearth for good doctors, amazing doctors. So I've traveled at least 20 countries, worked in 4-5 countries. I know how agile our country is. Why I say Bangalore also, because it's so agility, so many people at the tip of your hands. In one, my boss tells from Italy, Pramod lives in a 5-star hospital. From Italy he tells me this, because I has got everything under one umbrella. Radiation, medical oncology, 40 to 50 doctors, 60 doctors under one umbrella. It's like a family. So that is what I feel lacking. And number 2, in oncology we can't have a rat race. Everybody is different, as you said. Everyone is different. Like knee replacements, you cannot have 10 knee replacements. The same tumor, if it happens to me, it will behave differently.
Yes, sir. We also made our own studies. So we learned that sarcoma itself, like more than 200, 300 cases are type of sarcoma.
Types of differentiations are there.
First appears in a different way.
Nevertheless, play well with your children, have fun with your children. My best wishes. And I want a next YouTube video should go on 1 million views or something like that. Oh yes, please do it. I mean, that will be really enough for me. I'll be so happy. And not only that, with your children, playing around with them. That is the best gift I can get. I'm sure we all.
My wishes to sir from bottom of my heart and my bottom of my family. Wordless wishes.
Thank you for that, and I'm sure your parents will be waiting. I mean, it's already quite late. Yeah, so it's all the very best, Arun. Yeah, take care, man. Good luck. Okay, then yeah, good luck.